Hi friends, and welcome to the podcast series Proctology and Laparoscopic Surgery. I am Dr. Manas Ranjan Tripathy, Proctologist and Laparoscopic Surgeon with you again today. We are going to discuss a very common topic about the management of piles or hemorrhoids with special reference to conventional surgery versus laser treatment for hemorrhoids. Like we discussed last time, hemorrhoids, commonly known as piles, are swollen blood vessels in the lower rectum and anal canal, which are abnormally engorged. During defecation, these hemorrhoids slip out of the place, causing prolapse, bleeding, and rupture. A person's daily lifestyle is affected as piles cause discomfort and itching. Piles is a very common condition, but most of the patients feel reluctant to talk about it and are too embarrassed to see their doctor about it until the pain or discomfort becomes unbearable, or when there is profuse bleeding causing worry in their minds that it may be something more serious. Constipation, unbearable pain in the anus during a bowel movement, red colored discharge or bleeding along with stools, discharge of mucoid fluid, and feeling of fleshy tissue coming out of the anal canal are the commonest symptoms of piles. Sometimes few patients present with large lumps or masses around the anal canal which do not go in. Many reasons can cause piles. Some of them are weak rectal veins and walls due to aging, diarrhea, chronic straining during motion, which I feel is the commonest, and sitting for prolonged time in the toilet. Unhealthy food habits and obesity also have their effect. Arterial blood hyperflow causes swelling in these hemorrhoids, and hyperplasia and venous congestion consequently leads to engorged veins. Now, how do we treat these piles? More than 50 to 60% of patients, especially in India, present after having severe symptoms. The treatment of piles depends on the severity and the type of symptoms affecting the patient. Simple preventive measures like having a balanced fiber-rich diet and adequate water intake to allow regular bowel movement without straining is sufficient in very early cases with minimal symptoms. If this doesn't help, other treatment options follow. Sometimes oral medications or topical suppositories can reduce small bleeding piles. There is something called a rubber band ligation or band application. This rubber band treatment works effectively on small internal hemorrhoids which occasionally bleed. What it does is the blood supply is cut off with the help of a small rubber band which can be applied in the outpatient department. As the band and hemorrhoids fall apart in a few days, the wound takes 1 or 2 weeks to heal. This procedure sometimes produces mild discomfort and bleeding. Another option which was traditionally more followed was injection sclerotherapy. In this procedure, one chemical injection called a sclerosant is injected directly into the hemorrhoidal tissue, causing it to sclerose or dry and eventually fall off. This is a painless treatment when compared to others, but helpful again only for very small hemorrhoids. Piles that are not prolapsed can be ligated or injected. Both these procedures are done in the outpatient clinic and do not require hospitalization. But the major limitation of these procedures are they may not be beneficial for larger hemorrhoids and usually may need more than one settings of treatment. Now coming to the conventional treatment or open surgical procedures, what is essentially done is surgical excision of the hemorrhoids at all the positions after ligating the base of the hemorrhoids with sutures was conventionally done as an open technique. Major drawbacks of these procedures was increased pain after procedure, delayed recovery, and increased chances of anal stenosis, especially if large size of hemorrhoids were treated. One more option which is relatively novel is stapler hemorrhoidectomy. It was more or less introduced over the last decade, wherein circumferentially hemorrhoidopexy is done using hemorrhoidal staplers. This procedure is comparatively less painful than the conventional technique. The most latest and advantageous treatment option for hemorrhoids is the laser treatment. Laser treatment usually can be done as a daycare procedure. The principle here involves identification of the terminal arterioles of the upper rectal artery using a Doppler transducer placed on a specially designed proctoscope. After identification, the arteriolar electrofulguration is done with a fiber laser diode, causing interruption of the hemorrhoidal blood flow. This procedure is repeated circumferentially along all the clockwise positions of the hemorrhoids. Major advantages is the procedure is almost painless, can be done as a daycare, there is no wound, no dressings, and effectively no follow-up required. That's it for today. For further information regarding this, you can check out our website www.drmanastripathi.com. Thank you everyone for listening to me patiently for so long. I'll catch you soon with another interesting and important topic. This is Dr. Manas Ranjan Tripathi signing off.